Good morning, everyone. Just before I turn it over to Dr. Morrison for her Tuesday briefing, I just wanted to share a few opening comments and thoughts. First of all, that Sunday was a very exciting day for our province with the reopening to Atlantic Canada, and I can say with a certain amount of confidence that things are really moving in the right direction here for Prince Edward Island. I want to again say to Islanders, thank you. You're continuing to literally and figuratively roll up your sleeves to get vaccinated. We're now at 82% of Islanders with first doses and over 20% with second doses. So this is a major milestone in our journey, and really want to thank all Islanders for being so very vigilant in this aspect of our journey versus COVID. Our P.E.I. pass applications are rolling in, and staff at Office of Public Safety have been reacting with incredible speed. We've processed over 40,000 so far, and that has been a real positive for us. I also want to thank our border screeners and all of those who are working so diligently at our points of entry. We have administered almost 4,000 rapid tests at our points of entry over the first few days. And thus far, we've had no confirmed positive cases. So that's really, really comforting, and it's a great undertaking. And I want to thank all of those who have worked across many departments to make this possible. And those results from testing are giving us confidence so that we can move to further reduce border measures in the coming weeks. And these are all indicators, as I said off the beginning, that we are on the path toward a more normal summer here in Prince Edward Island, and I know that is something we all want. And based on that path we are on, Dr. Morrison made some recommendations to Cabinet this morning that will allow us to proceed ahead of schedule with our moving forward reopening plan. Based on the many factors, including the local, regional, and national epidemiology, along with our rapidly increasing vaccination numbers, we will be moving stage 3 up to July 18th. This will mean that vaccinated family, friends, and visitors from outside Atlantic Canada can come to P.E.I. with the P.E.I. pass beginning on July the 18th. We will start to accept applications for travelers from outside Atlantic Canada for a P.E.I. pass on Tuesday, July the 6th. On top of that, we will immediately remove masking requirements for indoor seated events within the province. Dr. Morrison will be sharing more details on these relaxation measures in a few moments. I also just wanted to say that as we cast our gaze forward in the days and weeks ahead, assuming that we continue to see low or zero positive cases at our points of entry and the continued upward trend in our vaccination rates, we will start to look at changing testing requirements at our points of entry for those Atlantic Canadians with a P.E.I. pass. That should make it look quite similar to what we enjoyed last summer when we were operating within an Atlantic bubble. All of that to say that we're getting there. And as we all had hoped, we're getting there a little bit sooner than we had originally planned. That is because Islanders have been so helpful in following the health protocols. They've been getting vaccinated, and they've been doing what has been needed all along to keep themselves and others safe. It's been said many times, but it does bear repeating again, that we've been leaders in this province in pertaining to protecting our citizens from COVID. We're the only jurisdiction to have had in-school learning for all students for the entire school year. We've enjoyed a level of openness in Prince Edward Island that many other Canadians haven't. And as we welcome more people to Prince Edward Island, which is what we've all been waiting for, we want to make sure that we don't take steps backward. And our plan was built on moving forward with some caution worked in. And that is exactly what we're doing. We're getting there a little faster than we originally hoped, and we're getting there safely. So I want to thank Dr. Morrison and her staff and everyone who's helped with that. And now I'll turn it over to you.
Okay. Thank you, Premier. Good morning. I think I'd like to start by saying I'm grateful and I'm hopeful at this stage that we are getting through this and we're getting through this together. Today I will touch on the COVID situation in P.E.I. and Canada and the reopening plan, as well as vaccine and some of the changes regarding our public health measures. There is one new case of COVID-19 to report today. This is an individual in their 50s with a history of travel outside Atlantic Canada. To note, they are asymptomatic but isolated appropriately. We've had a total of 207 cases since the pandemic began, and now we have one active case. In Canada, new cases were down 34% last week, and which is definitely week after week seeing that those cases are going down, and that's about just over 700 new cases a day, and that's a rate similar to what we experienced in the country in June and again in September 2020. There's been a sharp decline in the number of cases in the country in the last few weeks. The pressure on the health systems across the country is also on a downward trend. Hospitalizations are down 22%, and ICU admissions are down 18%. In Atlantic Canada, there are 90 active cases with 45 new cases reported in the last week. It is really encouraging to see the numbers in the region and the country going in this direction. Our public health measures and COVID-19 vaccines are working. As of Saturday, June the 12th, we have delivered over 142,000 doses of vaccine here in P.E.I, and 81.4% of the eligible population has received at least one dose of COVID-19 vaccine, and 20.2% have received 2 doses. Based on the supply of vaccine in P.E.I, we will have enough mRNA vaccine to fully immunize 50% of people aged 12 and up by the middle of July, earlier than we had originally predicted. Anyone who received their first dose of vaccine in P.E.I will be contacted to book their second dose appointment approximately 8 to 10 weeks after their first dose. Anyone who received their first dose at a partner pharmacy will also be contacted by the pharmacist to book their second dose appointment. There is evidence that an interval of at least 8 weeks between doses is important to mount a good immune response for most people. Anyone who received their first dose of vaccine before May at a health P.E.I clinic and have not received their second appointment should reach out to the vaccine booking line at 1-844-975-3303. We've had some questions regarding the interchangeability of Moderna and Pfizer vaccines. These are both mRNA vaccines and target the same coronavirus spike protein. The national recommendation regarding mixing mRNA vaccines is clear. These vaccines can be interchanged. If the same product is not available when it is your time for your second dose appointment, it can be used one or the other. So in other words, if you receive Pfizer for your first dose, it is safe and acceptable to receive Moderna for your second dose, and vice versa. Individuals who receive 2 doses of mRNA vaccine, 1 Pfizer and 1 Moderna, are considered to have a complete series of COVID-19 vaccine and are fully immunized. As our supply of Moderna vaccine increases, there will be more of this vaccine available at health P.E.I clinics and our 26 partner pharmacies. The COVID-19 vaccine record self-service portal is accessible to individuals immunized in P.E.I who provided a health card at the time of vaccination, either a P.E.I health card or one from another province. Updated vaccine records are available online within 24 to 48 hours after you receive your immunization. Since the portal was launched last Friday, over 5,000 people have accessed their vaccine record online. Individuals can also request a copy of their immunization record at the time of their vaccine appointment. I urge all P.E.I residents who have not yet scheduled their first dose of vaccine to make an appointment as soon as possible. Individuals aged 12 and up are eligible to receive the COVID-19 vaccine at one of the health P.E.I clinics. You can book online or by phone, and the phone line is open Monday to Saturday. In addition, individuals age 18 and over can book a first appointment at one of our partner pharmacies. And you can book online or go to a pharmacy to make an appointment. The goal of our vaccine program continues to be to immunize all eligible island residents aged 12 and over with 2 doses over the summer months. 2 doses provide better protection against COVID-19, especially against the variants of concern. Effective immediately, in P.E.I., it is no longer a requirement for individuals to wear a mask while seated at indoor events, provided there is 6 feet of physical distance between individuals of different households. This means that it is no longer necessary to wear a mask while seated at church services or seated concerts, provided physical distancing is maintained. Masks are still required at these types of events when people are moving to and from their seats. For now, when you are out of your seat at an indoor venue event, masks are required. Masks are not required when you are outdoors, but we certainly encourage people to wear a mask if they are in close proximity to others they do not know well. And it is understandable that some individuals will not be comfortable to attend seated indoor settings without a mask. This decision is a matter of choice. I encourage people who wish to continue wearing a mask in these settings to feel free to do so. In addition, effective immediately, dancing within cohorts at weddings is permitted. If you are vaccinated and have not been outside Atlantic Canada in the past 14 days, dancing with family and friends at a wedding is a reasonably safe activity. However, if you are not vaccinated or are immunocompromised, I would advise caution and recommend against dancing and other close contact activities at this time. Dancing in other venues such as bars, nightclubs, concerts, and festivals is not permitted at this time. The 5-step moving forward plan is based on meeting vaccine targets, low levels of COVID, and controlled transmission in P.E.I. and elsewhere in the country. The epidemiology of COVID-19 in the Atlantic provinces and in Canada has changed significantly since our reopening plan was developed. When our moving forward plan was developed, our neighbors in Nova Scotia were struggling with a serious 3rd wave and trying to get that under control, and there were higher numbers in New Brunswick. When our reopening plan was released, it was with the understanding that if vaccine targets were met and COVID-19 transmission was controlled, we would make adjustments. We met our first vaccine target of having 80% of eligible island residents over the age of 12 years vaccinated with 1 dose earlier than expected. As I mentioned, we expect to have 50% of island residents vaccinated with 2 doses by the middle of July. On Sunday, June 27th, we began welcoming friends, families, and visitors from Atlantic Canada and the Magdalen Islands. On Sunday, we welcomed 4,200 individuals to P.E.I. And in the past week, we completed over 4,000 molecular point of care tests in P.E.I. As the Premier King announced, we are in the fortunate position of being able to welcome visitors from outside Atlantic Canada effective July 18th. This will be exactly 3 weeks after we reopen to our friends and family within Atlantic Canada and Magdalen Islands on June 27th, and a full 3 weeks earlier than we originally planned. Effective July 18th, individuals from outside Atlantic Canada who are fully vaccinated with 2 doses and have a P.E.I. pass will not have to isolate when they come to P.E.I. This also means that P.E.I. residents with a P.E.I. pass who have 2 doses of vaccine can travel within Canada and not have to self-isolate when they come home. Those traveling to P.E.I. from outside Atlantic Canada who do not have a P.E.I. pass, who are not immunized, will be required to isolate for 8 days with a negative test on day 8. The same is true for Islanders returning home from travel outside Atlantic Canada if they do not have a P.E.I. pass and are not immunized. The P.E.I. pass application for fully vaccinated people planning to travel to P.E.I. from outside Atlantic Canada after July 18th will be available, as the Premier mentioned, online as of July 6th. Island residents, as was announced last week, island residents who have a P.E.I. pass based on 1 dose of vaccine are not required to update their pass to reflect their 2nd dose. Island residents should not travel outside Atlantic Canada unless they are fully vaccinated with the 2 doses. We recognize that in many provinces, including P.E.I., youth aged 12 to 17 only recently were able to access the COVID-19 vaccine, and it may not be possible for them to receive 2 doses before July 18th. For youth aged 12 to 17 coming to P.E.I. with family, there are 2 important points. Until July 31st, they are eligible for a P.E.I. pass as soon as they have 1 dose of vaccine and will not have to wait for 21 days before traveling to P.E.I. After July 31st, youth traveling with family from anywhere in Canada will be eligible for a P.E.I. pass provided they have at least 1 dose plus 21 days. As of this morning, 63,500 P.E.I. pass applications have been submitted, and I believe 40,000, or almost 60% of them, have been processed. Approximately 43% of P.E.I. pass applications are from P.E.I. residents. A sincere thank you to the staff at Justice and Public Safety who are working diligently to process P.E.I. pass applications. They are making good progress and are reviewing P.E.I. pass forms based on projected travel dates. P.E.I. passes will be issued prior to the date of travel. And as the Premier mentioned, we will be still considering and looking at the possibility of adjusting our testing regimen for P.E.I. pass holders in the days and weeks ahead. We have been receiving a number of questions related to the need for testing when individuals are fully vaccinated. There is still a risk that a vaccinated person can carry and transmit COVID-19. For this reason, incoming travelers to P.E.I. will continue to be tested at points of entry. Like immunization, testing is an important layer of protection against COVID-19. Not everyone will be tested on entry to P.E.I. 2 people per vehicle may be tested, preferably 2 adults. Youth under the age of 16 will not be tested at the points of entry. And if an adult is traveling with children, the adult and 1 child over the age of 16 may be tested. If the children are under the age of 16, only the adult will be tested. Our testing strategy, as I mentioned, will evolve as we welcome more people to P.E.I. and as more people are vaccinated, thereby reducing the risk of COVID-19. We've also been getting questions from P.E.I. residents who are not vaccinated and are required to travel to Halifax, Moncton, or St. John for medical appointments. Unvaccinated residents who have off-island medical or dental appointments will not be required to self-isolate when they come home, provided they follow the same-day travel guidance on the provincial website. The self-isolation exemption can be granted in situations where it's necessary for an individual to stay overnight for a medical appointment. Those doing same-day travel within Atlantic Canada will not be tested at points of entry and instead will be asked to monitor for COVID symptoms and tested if any symptoms develop. We've also had questions regarding false positive tests at the points of entry. We're using an Abbott ID Now molecular-based test at the points of entry. We are fortunate to have a good supply of testing materials and ID Now machines here in P.E.I. In a population with low levels of COVID-19, false positive results are not unexpected. The test is accurate 99% of the time. It is inevitable that we will get some false positive results. The screening tests done at the points of entry are considered preliminary. Anyone with a preliminary positive test result is required to have the result confirmed using a lab-based PCR test, which is the gold standard for the diagnosis of COVID-19. Yesterday was an important day for many island youth and families as it was the last day of school for many children. Some of my children I know had mixed feelings about the end of school year as it means transitioning to new schools and less contact with close friends over the summer, while others in my family were ecstatic to see the end of school with the hope that the summer will go very slowly. In a normal year, the end of school signals progress, development, and achievements for students, teachers, and staff. The end of the 2020-21 school year in P.E.I. is a monumental success for the education system, for students and families, for all islanders. As the Premier mentioned, P.E.I. was the only province in Canada that had a full year of in-class learning for students. Thank you to all Islanders for supporting our children. Your collective commitment and adherence to the public health measures allowed us to keep transmission low and contain the spread of COVID-19. Our children would have had an interrupted school year if P.E.I. experienced large outbreaks of COVID-19 and widespread community transmission. Late last summer, we discussed the benefits of in-class learning at one of the regular briefings and commented that the best place for children to be during the school year is in school, benefiting from in-class learning and socialization with their peers. I'm extremely grateful and proud that Island children have had a successful school year, despite the fact that we were in the midst of a global pandemic. Thank you to bus drivers, all school staff, teachers, administrators, students, families, and volunteers, and many others for your work in supporting in-class learning this year. It has not been an easy year on many fronts, and it has been especially challenging for the education system. Thank you for your dedication and commitment to supporting our children, the future leaders in our province. I hope you have a wonderful summer break and can find time to rejuvenate and prepare for the 2021-22 school year. And like some of my children, I hope summer goes by slowly for you. As we make plans for summer fun and adventure, I encourage Island residents to support our local attractions and businesses as much as possible. Our beautiful province has so much to offer those who live here, as well as families and visitors from off-island. As we look forward to celebrating Canada Day, albeit differently than other years, let us take the time to be grateful that we live in this beautiful, wonderful province where we are getting through COVID-19 together. And as we say, let us continue to be patient and let us continue to be kind. Thank you.
Well, thank you, Dr. Morrison. Those words mean more now than perhaps they've ever had, so thank you for that. And with that, I will turn it over now to some questions from our friends in the media.
Steve Bruce, CBC.
Yes, hello to you both. We've talked a lot about screening at the bridge, but how about in Wood Islands for passengers coming off the ferry? Have you heard much about how that process is working, and are there any changes in the work there? I've heard from some people asking, why can't you test people while they're on the ferry so that they're not having to wait when they get off in Wood Island? So has there been any discussion around that?
Hi, Steve. Yes, so absolutely. I think there's been discussion. Last summer, there was screening that happened on the Wood Islands Caribou Ferry, and that allowed some smoother flow of screening when people got off the ferry when they landed here in P.E.I. And so the testing and screening has started on land, but absolutely we are hoping that we are able to move onto the ferry, and we have been certainly communicating with them as well. One of the issues was around the connection with the computers and the machines. With the Wi-Fi, but so there's been some technical challenges there, but they are actively working on that. So we're really hoping to move on board to help facilitate some of that flow in the coming days.
Thanks so much. And I know you mentioned last week that you're at least in the process of coming up with travel rules, guidance for unvaccinated people. Is there any more you can say about that today?
Well, I think the Premier referenced a bit of it, and he may want to add to this, but I think we are looking at trying to get increased travel within the Atlantic provinces for those who are as well who are not vaccinated, but it will be based on our epidemiology here as well as in Atlantic Canada, and so I think that we're hoping that will happen. The P.E.I. pass certainly continuing to be important because it will help at the points of entry identify those who are vaccinated. So I don't know if you want to...
Yeah, I would just say that the follow-up to that would be that with our 80% of with at least one vaccination, as we look toward moving to Atlantic travel similar to what we had last year. So the P.E.I. pass, which is essentially, as Dr. Morrison has said, has been our vaccination pass, for lack of a better word, that will continue. And what we see heading forward would be you would move back and forth within Atlantic Canada. Those with a P.E.I. pass probably wouldn't need to be tested on the way back. Those without a pass might be tested. So we're trying to find that balance between getting people moving back and forth as safely as possible, but also giving the pressure on the requirement across the board for vaccination. So we're trying to find that balance. But I do think you will see in the days ahead, based on the numbers we're seeing, if they continue, that it will look a lot more like last year, perhaps, than it has in the first few days of this for Atlantic Canadian travelers. But we still want and are encouraging all travelers to have a PEI pass, because that's our best and safest way of traveling.
Okay, thanks so much.
And the one thing is that just to make sure people are aware, the PI pass is valid for multiple trips going back and forth, and I think so that's why another reason that's important. And every day we are testing so many people who are traveling within Atlantic Canada. Those testing numbers will also give us more information in the days ahead.
Great, thanks a lot.
Thanks, Steve.
Dave Stewart, The Guardian.
Good afternoon, Premier King and Dr. Morrison. Always great to talk. Just wondering, in terms of, it sounds like we're doing a stand-up job in terms of vaccinating Islanders, and the dates sound like they're moving up. Just wondering, in terms of the vaccinations, whether it's at the Charlottetown Trade Center or wherever, at this time of the year, people take holidays, and I know that Marion had said before that we have the capacity to, or increase capacity. Has that been an issue with giving staff time off and being able to maintain a certain average of vaccinations given per day?
Hi, Dave. I know Marion's not here today, but so she would be better able to speak to that. But I think we have been able to, certainly my understanding is that we've been able to continue to vaccinate people, because we only have a certain supply, but even as we have an increased supply, we have enough people to give vaccinations, administer vaccines, and we also have our 26 partner pharmacies, so that together I think it's been going well, and really all the reports are that those clinics are running very smoothly, our partner pharmacies are working well, and there's the people who are working there also know the goal is to try to get people vaccinated as soon as possible and as safely as possible.
Great, thank you very much. And I guess another question in terms of the fact that things seem to be moving in such a great direction and a lot quicker than perhaps it looked a few months ago. Is there any thought, how is the rest of the summer going to look like? I mean, so, in terms of events, you talked about masking and issues like that. Something like Old Home Week, I mean, is there a chance it could look like it did 2 years ago? Or are we just going to, is the approach to take it a little slower and be careful and not just jump back into normal life in August? Just kind of curious as to how this is going to affect events that are coming up.
Well, I mean, those are the really good questions. I mean, I think we have started doing some, I know it's been in the media as well about one of the bigger events with Rock the Boat. And now it won't be quite the same, because they'll be in cohorts that are outside. So I think those are events that have more people in them, in cohorts that are larger numbers of 200, and I mean those are what is being planned after the 18th. So we will continue to look at those numbers and cohorts, and for those big gathering events, we are reviewing those plans, and we'll continue to do so. And I don't anticipate it will be anything like it was 2 years ago, but it will certainly, I think, look better than it did last year. And I don't know.
Yeah, I would just add that I think many of our community festivals were not held last year. I think a lot of them, or the majority of them, will be held in some way this year, which I think is a positive move forward with the increase in gathering limits for outside, plus some of the programs that we have implemented to assist those local community festivals to adapt to some of the COVID protocols. I think it will look differently than it did last year. But, you know, so I think we're kind of getting there. In terms of Old Home Week, I'm not sure. I thought I had read where they weren't going to proceed with Old Home Week. I don't know if that's changed. In terms of the festivals, stuff around Old Home Week, I know they're going to have Gold Cup racing, for example, and that will be bigger than it was last year. But we're really in that, we're in that phase now where we're starting to look at these things. And I think last year communities were saying we're not having them. I think communities and festival organizers are looking now, and they're collaborating with Dr. Morrison's office to say, we would like to have these, how can we have them? And I think that has to be viewed very much as a positive this year.
We're getting there, and it's great to see. Thank you so very much.
Thanks, David.
Jessica Doria Brown, CBC.
Good afternoon to you both. My first question, I guess, is for Dr. Morrison. It's kind of a two-parter on the new date for reopening to the rest of Canada. Part one, kind of if you can elaborate at all a bit more on, any additional details on why you're confident that then is the right time to open up to the rest of Canada. And part two on that would be, how do you feel about that? Are you worried at all? We haven't done that since March of 2020. So just how are you feeling in terms of concern on that one?
Hi, Jessica. So I guess the first part is that we really want to try to protect Islanders, and by trying to make sure that at least 50% of Islanders, and I'm actually hopeful that maybe we'll get 70 to 75% of those age 60 and older fully vaccinated around the middle of July. So we know those are 2 doses offer better protection, especially against the variants of concern. So that's really important to have as many Islanders fully vaccinated as possible. And also the age group of 60 years of age and up, making sure they in particular have 2 doses, really important because that age group has ended up more often in hospital or severe outcomes during the course of the pandemic. So that's why for us wanting to achieve that target has been really important. And so and that leads into the second part of your question, am I worried? I'm certainly will be less worried knowing that that if there are cases of COVID, we'll be better protected here in P.E.I. And so I think that's part of it. I think like every Islander, we realize we have worked so hard for so long now that to see even what's happening out in Yukon with a big outbreak, none of us want to see that happen here. And so that's why we have a P.E.I. pass. It's why we are trying to make sure people are vaccinated before they come. We're trying to do testing at the points of entry to, again, have another layer of protection. So we're doing all these things to try to make sure Islanders are safe, and visitors who come here are safe too. So I think both parts are key, and they will. I'm always a little bit worried, but I think those things are helping. So I don't know if you want to add.
The only thing I would add is when you compare the years last year to this year. I mean, last year we were in a different situation with terms of COVID across the country, but when we opened to Atlantic, we kind of opened with a deep pause because we weren't didn't have the ability to do testing, and we kind of knew we were making this step, but there was some concern to wonder what the impact would be. This year, when the factors are different, but we were able to do the testing that we're able to do at the points of entry, we now have a pretty significant body of testing that gives us confidence to say we're in a good place here. So I think that that's a little bit different. And when we look toward opening to the country for vaccinated travelers on July 18th, we will maintain the level of testing, at least at the beginning, to give us that comfort. And I think that's sort of the built-in caution that we put into our moving forward plan. We knew that it wasn't going to be, as simple as we, as people had been pointing out. But I think islanders, need that level of caution. I think our small jurisdiction, we needed that level of caution. So the fact we're doing this, I think, gives us that little bit of hope. But I think Dr. Morrison said it best. You're never without worry in this, but we feel a lot better because we're doing it the way we are.
Okay, thank you both for that. And for my second question, just about our public health restrictions and masking guidance, and we got an update on that today. But just curious, what's next on your radar in terms of public health measures, including mask use? What are kind of the next areas that you're looking at in terms of easing or loosening requirements?
So I think all the public health measures that we are taking stepwise progression. So we have talked in the last couple of weeks about making changes in long-term care. So we've announced some of those. We're talked today about some of the easing up of public health measures related to masks. We talked about recently and what will come into effect the middle of July around increasing our cohort sizes. And a lot of that is based on our vaccinated population. So we are looking at it all the time and trying to make sure that we continue to take steps, and we are wanting to all get through this because it impacts everybody, and this is not something that has just impacted one person or one group of people. It's really impacted everyone in P.E.I. in some way, and so we're really trying to ease up these public health measures to a point where there's not a state of public health emergency, and that certainly I would anticipate that will not need to be in place by the end of the summer.
Okay, thank you very much.
Thank you.
Tom Bateman with the Times and Transcript.
Oh, hi there. Thank you for taking my question. Dr. Morrison, would you like to see P.E.I.'s rapid testing regime repeated or maybe even moved elsewhere in the Atlantic bubble? I'm thinking to somewhere like New Brunswick's land border with Quebec, where many from central Canada will enter our region as a whole. Thank you.
Well, that's an interesting question. I mean, I think we are fortunate in P.E.I. that we have certain very clear and only so many points of entry. So it puts us in a bit of a unique position to be able to even consider point of entry testing. We did a pilot of point of entry testing at the airport, at our one airport earlier in the spring. And then really we have very limited points of entry. So it does put us in a slightly different position compared to New Brunswick, for instance, with so many points of entry. And I think it's not for the faint of heart. I know a lot of departments were involved in trying to make sure we get these point of entry testing up and running. And it's pretty amazing that they have pulled this together. So I know what is common amongst the Atlantic provinces is that vaccination status for people coming into the region does matter and will matter. So in that way, it's that's very a common thing for all Atlantic provinces, and but I'm not sure it would be feasible for another province to put this in place, but I'm pleased that we're able to do that here.
Yeah, that's great. And you led into my second question on kind of the unity within the Atlantic region. We heard last week from your counterpart in Nova Scotia, Dr. Strang, about he and Dr. Russell in New Brunswick, I guess just disagreed over the level of risk their jurisdictions could or should assume in reopening to different kinds of travel. Given that, do you see any way for the Atlantic provinces to better align in the future to kind of resolve the patchwork travel rules that still exist, from province to province? Or should Atlantic Canadians just expect to have a slightly different travel rules that are tailored to the specific circumstance of the province that they're destined for the rest of summer? Thanks.
Well, maybe I'll just make one comment, and I think the Premier is probably best able to address that question. But I think we are actually all moving towards a fairly common place here, and the timing hasn't been always the same. But we're certainly common in the sense that we are trying to have movement within Atlantic Canada, and also treating those who are coming in from outside Atlantic Canada with wanting vaccination status, and that's important. So maybe I'll leave it there and let you add.
Yeah, I would only add that there's incredible consistency across the Atlantic region, just as Dr. Morrison has pointed out, in terms of what precedents we're giving to those who travel in and out of the region. And I don't believe there was much disagreement between anybody in terms of the risk factor. I think both New Brunswick and Newfoundland have openly admitted that the process to bring more Canadians in faster brings with it some risk, and I think where Nova Scotia and P.E.I. were coming at this is that we just look at the measurement of risk a little bit differently. For us, it's our limited capacity to deal with an outbreak, but I think Nova Scotia was also in the midst of a really big outbreak within the third phase of this COVID, and they were in a totally different place than the other jurisdictions. So each jurisdiction has that gift of jurisdiction to make decisions based on what is best for them. But I really don't think there's been a whole lot of disagreement in terms of the factors. There's a little bit of a misalignment right now in terms of travel, but I think that's catching up relatively quickly. And I just think that people who are traveling in this COVID world know it's been a disrupting factor, I guess. And they've become accustomed to be a little bit disrupted, but overall it's been pretty efficient and pretty consistent across the board. And from the four premiers' perspective, we always have different views and disagreements, but there's incredible alignment within the region, and I think that's why the region has done as well as it has, to be honest.
That's great. Thank you both.
Thank you.
You're welcome.
Gabrielle Trumeau, Radio-Canada.
Good afternoon to you both. Ma question c'est en français pour la docteure Edda Morrison. Vous avez déjà parlé de ce sujet en anglais, mais j'aimerais l'entendre en français, s'il vous plaît. Alors, pourquoi, docteur Morrison, vous vous sentez assez confiante aujourd'hui pour prendre cette décision d'ouvrir les frontières de l'île le 18 juillet et aussi pour annoncer autant d'allègements de mesures aujourd'hui? Pourquoi vous vous sentez assez confiante?
Bonjour Gabrielle. Alors, je ne sais pas si c'est confiance, mais je pense qu'on peut en faire cette décision. On peut bouger vraiment un peu plus vite qu'on a annoncé avant, parce que avec le nombre de personnes qui seront vaccinées à mi-juillet, c'est à peu près 50%. J'espère qui sont double vaccinés. Et puis, j'espère que 70% au moins des personnes qui sont 60 et plus vont être double vaccinées. Alors, et puis, c'est ces personnes qui sont plus à risque d'être à l'hôpital. Alors, c'est important qu'ils soient protégés. Et c'est à propos de protéger les insulaires ici, alors d'avoir au moins 50% des personnes qui sont vaccinées, ça me donne un peu plus de confiance. Et puis, on a aussi le P.E.I. Pass qui veut dire vraiment qu'on invite les gens qui sont isolés s'ils ont 2 doses de vaccin hors de la région atlantique. Alors, c'est important. Et puis, finalement, on va faire plus de tests au point d'entrée ici à l'île du Prince-Édouard.
Et ma deuxième question, c'est que aujourd'hui, vous annoncez cette accélération du plan de déconfinement. Et le Premier ministre Denis disait qu'on veut avancer, on ne veut pas revenir en arrière. Mais quand vous, Dr Morrison, vous voyez le cas de l'Australie, de la ville de Sydney, qui a été réconfinée en fin de semaine à cause du variant Delta, est-ce que ça vous inquiète si on va trop vite avec notre plan de déconfinement? Est-ce qu'à votre avis, il y aurait un vrai risque de ce scénario de réconfinement ici à l'île? Est-ce que ça pourrait se produire ici à l'île aussi?
Gabrielle, j'espère que non. Je pense qu'une des différences d'ici en Australie est qu'on a plus de personnes. Même aujourd'hui, on a 20% de personnes qui sont tout vaccinées. Alors, je pense que c'est pas la même ce que je comprends en Australie. Mais j'espère qu'on n'a pas un grand sorte de choses parce que et puis c'est pourquoi on fait assez on fait l'ouvrement vraiment assez pas trop vite pour qu'on peut faire encore les tests, essayer de trouver les gens qui entrent avec COVID. Alors, je fais attention, mais j'espère qu'on va avoir pas autant de risques d'en faire ici. Et si on trouve que ça commence, on va faire les changements.
Okay, parfait. Merci beaucoup. Bonne journée.
Bonne journée.
So, Dr. Morrison, I believe that brings to an end our briefing. So I just want to again please pass along our thanks and appreciation to all the staff who have helped get us to where we are today. And I would encourage islanders to get out and enjoy that wonderful day. So thank you very much.
Thank you.